American healthcare is in trouble, but luckily artificial intelligence is here to help. So here are 7 ways that artificial intelligence will revolutionize healthcare. My name is Dr. Daniel Shin, also known as the Darwinian Doctor. I'm a board-certified urologic surgeon, investor, and I'm passionate about physician wellness. With the explosion of artificial intelligence over the last few months, it seems like we're entering a brave new world. But rather than a dystopian future where AI controls our every move, I foresee a future where AI can be harnessed for the betterment of humanity. When it comes to healthcare, I believe that the influence of AI is going to be both profound and overwhelmingly positive, and it couldn't come at a better time. The COVID-19 pandemic has taken a troubled industry and brought it to the brink. Even prior to the pandemic, we were calling the physician burnout problem an epidemic. Now, a few years into the pandemic, the burnout problem is even worse. Layer on top of this a looming physician shortage and the Great Resignation, and you've got a healthcare industry that is on the brink. Everything I've noted here, by the way, can also be said for nurses, pharmacists, and technicians. It's imperative that we do all that we can to decrease the burden on our healthcare workers. We're lucky that artificial intelligence is entering a golden age of innovation ready to help our healthcare workforce. So let's talk a little bit about artificial intelligence, because in its highest and best form, AI augments the brilliance of mankind. AI has the power to make us smarter, faster, and more productive. I think the best example of this is ChatGPT, which is a chatbot that was launched by OpenAI in late 2022. It's really a remarkable tool that was trained on terabytes of data and fine-tuned by researchers, and it has the ability to generate remarkably responsive and natural text that sounds just like a human talking to you. Now, for the first time, the general public is starting to see the implications of AI in our society. So as a urologic surgeon, blogger, and amateur futurist, I'd like to put forth an argument that AI has the power to save the healthcare community. Investors really believe this as well because they've poured billions of dollars into this sector over the last few years. So when I think about all of the pain points in the daily lives of our nurses and physicians, there are so many ways that AI can help. So today, I'm just going to go over 7 areas where I think that AI is going to revolutionize healthcare. Electronic medical record assistance, diagnosis of health conditions, patient messaging triage and response, patient results triage and interpretation, cancer research and drug discovery, personalized medicine, and patient monitoring. I'm going to go over these one by one and explain why these boring topics are actually really big pain points for our workforce and how AI can really help. So I can speak from personal experience in regards to electronic medical records. Since the mid-2000s, when I started my medical career as a med student, I became intimately familiar with the EMR, and I know that it's both a blessing and a curse. So originally, the EMR was touted as a solution to basically decrease human error and share data between health institutions over a common system. It created the ability for patient data to be shared in digital form and recorded for future clinicians to check back. You didn't have to look through big stacks of paper medical records anymore, you could just look it up in the EMR. Along the way though, it's been combined with billing systems, appointment systems, and also patient messaging systems, and it's become an incredible source of frustration for clinicians. In my urology practice in Southern California, I usually had about 15 minutes to spend with each patient. If you took into account the few minutes that I used to review the patient medical record and actually walk to the clinic room, I usually only had about 5 minutes to talk to the patient, because the rest of the time I was entering in notes into the medical record and entering in orders. Even then, it was very common to get behind on the notes, so that after a clinic day, I would always have to spend about an hour finishing up my notes from the day. I know better than to complain about this because I have plenty of friends in primary care who routinely go home and then spend a few hours every single night finishing up patient notes. So this is how artificial intelligence is going to help with this problem. Voice-to-text transcription technology has already gotten way better. There's already been progress with the use of AI in helping physicians with notes. Voice transcription software has gotten so much better over recent years, but the problem with voice transcription software in my own personal experience is that it's still fairly error-prone. So you can't really use it in front of patients because you have to be in front of your desk and your desktop computer. You have to transcribe the data into the electronic medical record system, and then you have to take time to correct it before you have a usable note. So you end up having to do this after the patient encounter, and a lot of the times it's just as time consuming as just typing the note itself. I found that the AI transcription software is good for reducing strain on my wrists due to less typing, but time-wise, it doesn't really save me that much time. So the next generation of AI when it comes to help in this note-taking and electronic medical record problem is called ambient clinical intelligence, or ACI. This technology aims to basically operate completely in the background, almost like a medical scribe. Deep Scribe is an early breakout in this field, and they say it's the world's most widely adopted AI-powered medical scribe. Their demonstration video is really impressive, and basically it shows a physician talking to a patient, and in the background, the software is basically transcribing that note into a really usable note, like a history and physical, that would normally have to be completely manually typed out by the physician. Beyond just note-taking, I see AI being really helpful one day in order entry. Doing a very simple thing like ordering a CT scan or discharging a patient from the hospital might take hundreds of clicks in the medical record system. So an AI system that can predict what you're going to need and help you actually put the order in can be very helpful. Just like improving the process of note-taking and note entry, I think that this AI technology can really reduce physician burnout and increase efficiency. So how is AI going to help in the diagnosis of health conditions or illnesses? So I think that the diagnosis of everything from lymphoma to a broken hip can be facilitated by AI. Radiology is already a specialty that is really being helped by AI. There are programs out there that can look at CT scans and X-rays and diagnose everything from lung cancer to an intracranial hemorrhage. So as an image analysis tool, AI is really going to speed up the diagnosis of various radiologic conditions. I think this is going to decrease healthcare costs and improve patient satisfaction because they're going to be getting their results faster. There's always a concern out there by radiologists that they're going to be replaced by a computer program, but I just don't see this happening. You're always going to need a responsible party in the radiologist's chair who can take the legal responsibility of making that diagnosis. So I think that radiologists' jobs are really safe. Their lives are just going to become faster and easier due to AI in the future. So I've heard from some of my radiology colleagues that being a radiologist sometimes feels like you work at the postal service. The images like mammograms and ultrasounds and CT scans, they just keep on coming. So anything that increases the probability of an accurate diagnosis while decreasing the time it takes to get that diagnosis, I think would be welcome. But I believe also that the benefit of AI when it comes to diagnosis won't be limited to things like radiology. By operating in the background of the EMR, basically AI will be able to diagnose things alongside physicians. By integrating everything from patient complaints to diagnostic data like vitals, lab tests, and radiographic information, machine learning AI systems can augment human ability to diagnose things. I see machine learning AI systems offering a number of possible diagnoses, and it's not like AI is going to replace a physician's diagnosis. I see AI more like an educated second opinion from a respected colleague that can help inform your decision. And finally, depending on which diagnosis you choose, I can see AI as offering a plethora of information about the possible treatment options. Over time, I expect the medical field to benefit from fewer misdiagnoses, improved clinical decision support, and better outcomes. Patient messaging, triage, and response. You might be surprised that I'm including the topic of patient messaging in a post about the exciting applications of artificial intelligence, but let me tell you, patient messaging is one of the biggest pain points for physicians out there. Modern healthcare is all about increased access by patients to their nurses and physicians. From the patient perspective, this is really a good thing because you can more easily ask about that lab test result. And for small things, you can just ask them over email rather than going in for an appointment. But the dark side of this convenience is a never-ending deluge of messages for physicians. So in my 14-person urology group in Southern California, we would routinely get hundreds and hundreds of messages every single day from our patients, even weekends. We actually needed this small army of medical assistants and nurses to sort through the messages and see which ones were urgent versus which ones were actually not medically related. A lot of these messages were for things like getting an appointment, whereas there were a few out of the hundreds of messages that were really important, like, "Doctor, I have a fever," or "I think I'm having a complication for my surgery." But since there was only a rudimentary sorting of these patient messages, we were always behind in getting to these messages. This led to a lot of angry patients and occasionally worse outcomes for patients. And my colleagues would routinely cite patient messages as one of their biggest problems and reasons for dissatisfaction with their jobs. Since we all had a busy clinic day, we would often only be able to get to these messages after hours. So remember how in the last section I talked about how I would have to spend an hour after clinic finishing up notes and putting in orders? So add on top of that, another half an hour to an hour answering patient messages. By this time of the day, after a long clinic day, I'd be so hungry and tired that I'd be answering patient messages half slumped into my chair with my eyes really half closed. And occasionally some of these messages would be urgent, so I'd have to try to figure out how to deal with these patient messages after hours, which was not easy. I suppose I could have come in an hour early to work to deal with patient messages, but that was really tough. So how can AI help with this problem of patient messages? Well, researchers at Vanderbilt did a recent study where they actually tried to use AI to sort patient messages by complexity. Although their machine learning system wasn't ready for prime time just yet, it was an important first step in this process. I envision an AI system that will efficiently sort patient messages and categorize them into things that are important or routine things like appointment requests. The AI system will also be able to respond to those appointment requests and basically offer patients appointments and book them without any intervention by humans. A system like this could provide incredible cost savings while really improving the efficiency of clinicians and improving the ability of clinicians to get back to patient messages much faster. A related but different way that artificial intelligence will be able to help is with patient results. So we've talked about the problems with notes, we've talked about the problems with patient messages. Now how about patient results? What are patient results? Patient results are everything from lab tests to imaging results and pathology results. Physicians use things like this to see what's going on with you, to check your electrolytes in your blood, or check to see if your bone is fractured, or to see if you have cancer in that part of the body that we just biopsied. But every time we order one of those tests, it comes back as a result into our inbox, and we have to respond to that appropriately. And the more tools and technology and options that we have to diagnose illness, the more results they generate. Thankfully, the majority of the labs that I order in my field come back as normal. But it's the abnormal ones that really take a lot of time and attention. So when an abnormal test comes in, I have to go through a decision-making process to decide to do one of four things. So we can either repeat the test immediately, we can repeat the test in a few months, we can have the patient come into the office for a discussion to decide what to do together, or we could decide on an intervention like a biopsy or an x-ray or something like that. Many times in a collegial setting, you'll actually consult your colleagues or call another specialty to decide what to do with an abnormal result. So while the majority of results you can actually take care of in just a few seconds, a minority of them maybe will take 10 minutes or 15 minutes to take care of this result. And if you get dozens of results a day, it really adds up. Just in the way that an AI system can help you with patient messages, I envision a powerful AI-driven tool that can do a few things. Categorize results by acuity, suggest the next steps based on those results, provide links to supporting information and research relevant to that result. Also, and really importantly, assist in the next step. Whether that next step is contacting the patient, setting up an appointment, or ordering a follow-up test, the AI could efficiently assist you in that process. So something that usually might take 50 clicks to order a CT scan, it may take many fewer. When it comes to patient results, an AI tool can save tons of time and also just make physicians so much more efficient. So we're moving along here. I hope that by now you've become really excited about the potential of artificial intelligence to improve healthcare. The next thing that I want to talk to you about is the ability of AI to help with cancer research and drug discovery. These days, from breast cancer to lung cancer, the most innovative types of treatments are called immunotherapy. These types of treatments are targeted specifically to your type of cancer. Identifying the type of immunotherapy that is going to be helpful for a specific type of cancer is very difficult. New AI models like the one powered by Google's DeepMind have shown a lot of promise in predicting and modeling the complex ways that proteins can fold and interact. This has the potential to really speed up the development of new immunotherapies. So one day soon, I foresee a future where AI systems will be able to take your specific type of cancer and model the best type of immunotherapy that will be able to combat that cancer and then you'll be able to develop that immunotherapy, inject it in, and treat your specific type of cancer with precision. Now let's talk about personalized medicine. Same way that individual patients can have targeted cancer-specific treatment, AI will also be able to provide a personalized level of medicine that is currently not possible. For example, I'm Asian. I am about 40% more likely to develop diabetes than non-Hispanic whites. Why is this the case? Certainly some of it is probably cultural and dietary related, but probably some of this phenomenon is also due to just genetic differences. So in the near future, AI will be able to deliver a level of personalized medicine that is specific to your ethnicity and to your genetic makeup. There will be new opportunities for the prevention of disease before it even develops. AI systems will be able to use your personal information, like your medical history, your lab results, your test results, and develop a personalized system for optimizing your health. Probably the first step in developing a level of personalized medicine is just mapping the genetic makeup of more ethnicities. A lot of our medical science right now is predominantly white and Caucasian, and we need to basically have more information about the genetic diversity out there. Now, this is an area that is fraught with bioethical concerns, but if we can surmount those concerns in an ethical way, this will lead to an era of personalized medicine that will be increasingly more specific and more effective. Now, I think it's important to mention that cost is going to be a really significant hurdle to an era of personalized medicine and also cancer-specific AI-driven care. If you can imagine that developing new drugs these days can cost billions of dollars, you can imagine the difficulty for developing a specific type of immunotherapy for your cancer as opposed to the cancer of someone down the street. So we probably have a long way to go before we can effectively institute something like this, given our economic system currently and the way that healthcare exists in our community. But if we can get through those problems, I can imagine a future where you'll have a specific plan to best improve your chance at a healthy, bountiful life with as much longevity as is possible for your genetic makeup. So the final way that I foresee AI revolutionizing healthcare is in patient monitoring. Now again, this might seem like a very boring way to use AI, but it's really important. In the hospital right now, literally right now, no matter what time of day you are watching this video, there's someone sitting in front of a monitor watching vital signs and cardiac telemetry results. A well-trained professional is looking for changes in blood pressure results and telemetry results to see if anything dangerous is going on. Artificial intelligence in healthcare offers the power to be another set of eyes on that patient. Rather than replacing that cardiac nurse, AI can augment their ability to predict and react to dangerous changes in their patients. I'd like to take it one step further though, because I think that AI will do much more than monitoring. I think AI will also be able to do a lot of prediction in the healthcare setting. Here's an example. As a urologic surgeon, one of the most puzzling and dangerous situations I deal with are patients who come in with infected kidney stones. The combination of a febrile urinary tract infection plus a kidney stone that is obstructing the urinary tract is very dangerous. To treat this, you need to have a combination of antibiotics, a diversion of the urine with a stent, and also close monitoring. It's really quite difficult to know exactly which patient will become septic or which patient will actually do quite well. Sepsis is a dangerous combination of severe infection and low blood pressure that can be fatal. So when I admit a patient to the hospital who has an infected kidney stone, I'm often worried about the patient becoming septic. So I order labs very frequently and I put that patient in a setting where they can be closely monitored. And although sometimes you can easily tell which patient is going to become septic, a lot of times I'm surprised. Some patients who I thought would do quite poorly actually do quite well, and the next day they're completely turned around. Whereas other patients that I wouldn't expect to become septic can actually do quite poorly and spend a week in the hospital recovering from a severe episode of sepsis. I think that through a combination of deep learning, integration of real-time vitals, medical history, and labs, AI will be able to tell us which patients have the highest probability of becoming septic. This will lead to less burden on physicians and nurses and the ability to target care towards those who need it the most. In conclusion, for many years, artificial intelligence has been right around the corner. We've been tantalized with the promise that AI will develop tons of benefits to our society and to healthcare. but we're finally at a point where we're actually seeing it in real time, and it's such an exciting time. I firmly believe that AI is going to do so many things for healthcare. It's going to improve efficiency. It's going to offer solutions for the diagnosis, treatment, and monitoring of our patients. It's going to help us respond to patients' messages faster. It's going to help us triage results faster. I believe that through AI, we'll be able to reduce physician burnout and offer a lot of solutions for a healthcare industry that has really been struggling in recent years. So again, my name is Dr. Daniel Shin. I'm the Darwinian doctor. I'm passionate about personal finance, investing, and physician wellness, as well as healthcare. So if any of this resonates with you, I would ask that you like this video and subscribe. Thank you so much, and see you next time.